right, so welcome everyone to our financial assistance webinar. This is part two of a two-part series on financial assistance resources, what's available and how you can access them. We have our lovely panel of experts here who are going to sort of walk you through some information and answer any questions that you may have. If you all would like to go ahead and introduce yourselves, I'm sure you can introduce yourselves better than I can, so please take it away.
I'll start. I am Erin Bradshaw. I am with the Patient Advocate Foundation, and I am the EVP for the Advancement of Patient Services and Navigation, and have been with the organization for 26 years. So my background is within navigation and intervention support, and we'll be sharing some more information with you shortly.
You go ahead, James.
Okay. Hi, everyone. My name is James Ridley. I am the Director of Clinical Affairs here at the PAN Foundation. I've been with the PAN Foundation for almost 2 years now. If you don't know anything about PAN Foundation or you were on our last webinar, we are a charitable assistance program organization, and we help patients with the out-of-pocket costs for their medications. We also do work in advocacy and education.
And my name's Jennifer Noonan. I work with Accessia Health. Also, just like Erin and James, our organization is a charitable nonprofit assistance organization. We do help patients with rare, complex health problems and paying for and affording access to their health care. And we're happy to be here today. I'll kick it back over to you, Ashley.
Lovely. Thank you so much for introducing yourself. So the first, and I would say probably the main question that we want to ask here and sort of address is what each of you are seeing as the biggest need from the patient community today, just as a whole, and what is available from you and just in general to address that need. Erin, if you want to go ahead and start it, or James, Jennifer, whoever wants to. Laura's feeling brave.
Okay. Yeah, I should have highlighted earlier. So Patient Advocate Foundation's mission is to provide case management and financial aid to those with chronic, life-threatening, and debilitating conditions. In particular, financial navigation is a critical need for many as they undergo the course of their treatment journey. As I look at case management as a specific carve-out and that intervention type of work, our 2023 annual impact really highlights that struggle with just juggling a medical condition and also being able to afford things like health insurance and the recommended treatments and medications. And when you couple that with the struggle to pay for essential costs, as well as those necessities like food, transportation, shelter, and then the impact of being away from work and a loss of income, really does generate a lot of need around helping navigate those financial barriers, understanding and getting the payments through your health insurance. We do a lot of work around health insurance navigation. So whether that's using the plan accordingly or even mapping you to health insurance if you don't have it or adequate coverage. And in addition to disability, so maybe someone's moving from an able body to a disabled body. So 5 out of the 10 issues that people come to us with are related to these out-of-pocket medical costs and the insurance navigation. So it is a very critical component of where people definitely need. We've also done some research studies around the administrative hurdles that a lot of these things cost. So like time toxicity, and in addition to financial toxicity, is a very critical and challenging component of navigating all of this access to care issues. And so, we recognize it in our own work and what it's taking for our staff to help individuals navigate all of the safety net solutions. But when we asked our patient pool directly, alarmingly, 55% of people shared that they have allocated quite a bit of time to health insurance administration tasks, and 20% said that it was 16 to 30 hours, and 18% that said that there was too many hours to even count. So I think that those are just components to understanding that as we talk about this conversation of financial navigation, it's bigger than probably just finding a one solution. We might find ourselves with creative problem solving and trying to find all potential avenues that will hopefully circumvent some of those barriers that are there. And I think that's what we'll be talking about as we move forward through this presentation.
James, do you have anything to say, or Jennifer, either of you?
Yeah, absolutely. And I'm going to kind of share this on the lens of a pharmacist. And one of the biggest needs from the patient community today is often related around affordable access to medications. And then another big issue is the comprehensive health literacy. Many patients struggle with the high cost of medications. We hear it all the time, especially with chronic conditions like diabetes, cancers, or autoimmune diseases. And this is compounded by the confusion about how to even use or the patient to take their medications properly or understand the potential side effects or the interactions. When we think about like affordability, with the rising drug prices, is making it very difficult for patients, particularly those with limited insurance coverage or high out-of-pocket deductibles, to access the medications that they need. As we all know, with the Medicare reforms, that the out-of-pocket cost of Part D is decreasing. But one of the things that is increasing is health insurance premiums. So while some patients are, being helped with the out-of-pocket cost of medications, the insurance premiums are going up. So affordability is a huge piece. And then we think about like the health literacy, like patients often struggle to understand their medications. I used to see it all the time, even pronouncing their medication and then coupling it with what the medication is used for, when and how to take them, potential side effects and interactions with other drugs or foods. And then medication adherence. This is a significant, I think someone is not on mute. It's a little background noise. Thank you. With the medication adherence, there's a significant number of patients having difficulty adhering to their prescribed treatment regimens, either due to the complexity of the medications, the side effects, or they just simply forget them. And then another huge area is access to care. Now, in a lot of underserved areas or rural areas, access to healthcare providers and pharmacists is limited, which affects the quality of care and the continuing them and patients continuing their treatment. Those are some of the areas that I have seen there's a great need. And as we continue on, I can offer some solutions to some of those issues.
I'll be curious to hear what those are too. Just came from being at the National Association of Specialty Pharmacies had their annual meeting, and the big discussion was all around access and the critical needs that are going on with all these advancing treatments, the increased cost of those care. And we do know that that cap is going to be great, right, for a lot of people. But we are seeing some of the same things that both of you have already mentioned. While we have seen a bit of a shift in copay cost over time with some of the medications that have become more broadly manufactured and utilized, at the same time we're seeing an increase in the cost for premiums. At a recent 2 back-to-back meetings that we had gone to, we actually polled everyone that we talked to just to kind of get a feel. Like, these are folks on the ground. It was a patient-centered conference, and 50% of the people who responded, and it was just 2 questions. It was a whole list of things that we've all mentioned, but then which of these have you found to be the biggest barrier? Or if you were a provider, which was the biggest barrier that you felt like your patients were experiencing? And half stated that it was increasing cost of premiums. So having that insurance now that will help cover some of those larger costs, I think, is also an ongoing problem. And as Aaron mentioned, the care navigation and helping people to just look at those different plans that are out there agnostically is, I think, something that all of the financial organizations, at least the 3 on this call, have opportunities for people to help with that. If someone is uninsured, or if they have, like, again, Aaron mentioned people who are changing maybe from commercial insurance, moving into the Medicare world, or perhaps they have become disabled in their body and they've gone through the process to get that changed. It changes how they are insured. So it changes what their options are, and it is a tricky environment. So leaning on those different options you see in the financial resources for care navigation, I think is going to be critical for people who need to make some decisions that are difficult. And we can't drive people to a specific plan or a carrier, but we can help them look at their different health problems that they have that they're managing and needing to pay for regularly, and help them choose agnostically a choice that's going to work best for them. And then we do help cover the cost of those, as well as other financial organizations that help with those costs of premiums. But I think one other thing that we saw that almost everyone listed as a secondary barrier, if it wasn't the first, and it was your day-to-day living costs, housing, food, transportation is really big, because I think sometimes I think of transportation just associated with going to the doctor, because that's what we have built into the programs. But if someone can't afford gas to go to the grocery, they certainly are not going to be able to make it to their doctor's visits. And to James's point, to talk about health literacy, I worked in hospice for a long time. And when people are dealing with complex health problems that have a lot of emotional burdens with them as well, they rarely are able to maintain a lot of information at one time. And so the pharmacies being able to have repetitive and ongoing, communication and education with patients is going to be imperative to them understanding their treatment and then being compliant. So I think we've all kind of said somewhat of the same thing. And it looks like there's a couple questions coming through. Ashley, did you want to field some of those over?
Yes, I was going to say we have gotten a couple questions in the chat specifically about home adaptation. We have someone here who is apparently losing their ability to walk the stairs to their bedroom. So what sort of things would you say are available or could be done financially for people like this who are dealing with this? We've also had some questions from registration about equipment to get to the home in case for ADLs, therapies, and things like that, stair risers and whatnot. So for that sort of thing, what is available and what can be done about it?
So I can start off by kind of talking about what typical benefits. A lot of this has to be it's very customized. So I'm going to speak very generically around possible solutions, and then maybe give you some direction on where to look or seek out services from one of our organizations to dive a little bit deeper. But needing those types of accommodations or even home modifications is very dependent on the insurance that you carry and what they consider to be a covered benefit or not. Some of them may not be, they might be considered exclusions, and we have to look at other resources to generate either donated products or loan items. Medicaid in your state often will have a much more expanded benefit package, but you must meet the financial and asset eligibility. And there are many different layers within Medicaid. So for the purposes of not trying to complicate it further, I do encourage for everyone to explore that. And there's waiver programs and things of that nature. There's also crowdsource funding opportunities. If you haven't heard, there's one called Hope Help Live, and that's a little bit different than your GoFundMe aspect, because they're a nonprofit organization that will help provide you with the resources and how to crowdsource. And then they also will provide bill paying and the components, which if you were to do that independently and were to gain those assets and you were on a state or federal safety net program, you could be at risk of losing those benefits. So we like to just share those components when we're talking about that. But there are, state and local programs. There are disability support systems in your area groups that are in the disease-specific space. So that I'll pause there, but there's search engines and things of that nature too. But it really does require us to dive a little bit deeper and understand if it is a true limitation exclusion, or are we looking at trying to maybe appeal a denial of sorts?
I'll just add to that, Erin, you covered that so comprehensively. The other place I found in looking for this very type of thing for someone not too terribly long ago who was needing to have some wheelchair ramps rebuilt on the outside of their home, we discovered that Habitat for Humanity, state by state, is different, but that if you look at the state level, find the habitat for that location, that they actually almost all have some branch that will do home modifications. There's a process as everything, as everything is in this. It's like you don't have enough to do. Here's 12 more steps you have to go through. But the people that I've known that we've had 2 different patients follow through, and I can maybe try to figure out, if there's any tips that they might have in the future. But ultimately, they just went on and followed the instructions to apply, and then go through that process where they can come and help do things like that if it's actual labor type of work for home modifications.
Do you have anything to add?
No, thank you, Aaron and Jennifer. I will say, honestly, this question is not something that I necessarily work with on a regular basis, but more importantly, it does highlight the need for resource hubs, because there are so many resources that are available, but they tend to work in silos. And you may have one resource here that offers a very specific thing, and a patient or a person may typically, when someone comes with one issue, they have 2 and 3 following them. So it's that I really speak to the work that needs to be done around more resource hubs, so that advocates and patients can go to basically a one-stop place to find multiple different areas in which they could find need.
Great. Erin, you had mentioned that there was a search engine, and that sort of brings to mind this idea of, is there a way, first, if you have the name of the search engine, obviously, please share that with us. And that's something that we can send with all of our participants afterwards so that they can have access themselves. But just ways, any advice that you have to simplify the search for these kinds of resources, to find this sort of information, ways to search accessibly, because these kinds of things can be difficult to just sort of hop on Google and find. So any advice that you guys have on sort of guiding the rare community in how to search for these sorts of things and what these platforms look like and how to find them would be, I think, very helpful.
There are so many trusted and validated search engines. We actually house one. It's called the National Financial Resource Directory on our patientadvocate.org website. That's one of several. Within that tool itself, we actually link to others, because you have United Way, you have Find Help tool. Even some of my colleagues here have some others, and they can be. I really recommend that you do navigate towards a trusted national charity to ensure that you are getting comprehensive and accurate detail. Unfortunately, we have a lot of scamming scenarios, and I don't want anyone to be caught up in situations that they're being promised government funding or something that might seem very promising, especially when you're in a very crucial state where it's needed. So certainly make sure that you vet your assets, and I'll throw some into the chat as we continue our conversation.
Mm-hmm. And I will say, is one hub that we've created at the organization at Pan Foundation is called Fund Finder. And what that is a web-based tool where it's 9 charitable assistant organizations who do the similar work that we do in regards to getting disease funds and the availability of them. It's a place where providers and patients can go, and basically it'll scan all of the foundations to see if there is any funding for that particular disease state. And it has been very helpful, because if one of our organizations are able to help a patient because one of our funds is closed, or we don't currently support that particular disease state, it's good to have a place that I can refer you to an organization that can help you.
Yes, I have signed up for both of your uh, information about open, but I tell people that all the time. None of us want a lot of spam mail, but my organization and I definitely know about PAN and PAC both have an opportunity to say, I want to be notified if programs open. And that is the quickest way, because I can't speak for the other organizations, but we basically announce openings publicly at the same time anywhere. So that would be kind of a first notice that anybody might get that a fund became open or had funds available after maybe it had been, waitlisted for a while. So I always encourage people to also make sure that they sign up if they have a need. If it looks like it's closed or if it's waitlisted, you'll never see that open door if you're not in the line, because we all work, our wait lists are all first come, first serve. And so just also tell folks that they need to sign up if they feel that they need help, so that they can be in line when the doors do open.
That's super helpful. Thank you. The next question I would have, and this is something that came up again from our registration questions, is that there are sometimes organizations that will only do assistance for copays for medication only. They don't help with premiums. Is there any, first off, I guess, of course, I'll ask if you offer any assistance, any of you, on dealing with those premiums, and if not, if what other organizations and resources are out there to pay for some of those other expenses, and just what are some ways that people can deal with that?
I can share. Oh, sorry. Go ahead,
No,
James.
go ahead. It's fine.
Patient Advocate Foundation's copay relief program does. You'd have to look at copays.org and available funding, but there are many that do offer premium assistance in addition to the copay, coinsurance, and deductibles of the cost associated. But then, it also can be creative solving, very maybe non-conventional, but alternative solutions we might want to consider would be exploring based on your financial situation, if maybe you are qualifying for, you say you're on a marketplace plan, and are you getting the cost sharing that's available to you based on that. And that's something you really should assess often, especially if you've had an income change, because you might have not at the time of enrollment, but maybe that has occurred then. As well as if you're on Medicare, you have Medicare savings programs that you can apply for through your state Medicaid program. They can range from covering just your premium all the way through your out-of-pocket costs, depending on where you fall in that range, as well as Extra Help, which is a Medicare Part D or prescription cost saving program. Those are just some highlights that come immediately to mind.
Thanks, Erin. And we also help pay for premiums. Again, most of our programs are kind of set across a standard, but we have a few programs that have been around for a while and have patients already fully subscribed on those programs that might not help, but most of our programs now will assist with premiums if a person is uninsured, or if they are insured, we can help with paying those to ensure that they're able to access treatment. I think you all are the same at PAN, right, James?
Yeah, we have copay funds and premium funds, and the patients are eligible to enroll in both, so they can receive premium assistance and copay assistance, and then also transportation assistance as well.
Yeah, we have transportation assistance as well.
Great, thank you so much. All right, so I guess we can just sort of pivot again to, we mentioned the first question that we started off with is, what is some of the biggest needs that you're seeing in the patient community today? And I think we sort of touched on some of the services that you all sort of offer, but if we could just sort of get each of you to go through and just talk in full as much as you are able to within the time that we have left, about what exactly you offer, it is, how you can help the people here and address some of those needs that you have seen. And obviously, if anyone has any additional questions in the chat, any needs in particular that they'd like to see addressed and get an answer to, please drop it down in the chat. We're trying to sort of have a conversation here, so please feel free to ask the question. So whoever wants to start means.
No problem. So I can touch on, I highlighted a few areas that I saw that and see that there's a big need for patients. And we talk about, like I mentioned, affordability. Like there are patient assistance programs. We just talked about this, similar to what we are, that are available. Also, drug discount cards. And sometimes, if there is a patient that is prescribed a medication that is either brand or very high generic, it could be requested that the doctor switches the patient over to a generic alternative that would do similar and produce the same health outcomes and decrease the barrier of the financial barrier for the patient. And then also some pharmaceutical companies offer copay assistance and free drug programs for those who qualify. So I often tell people they're necessarily not able to are eligible to enroll in a patient assistance program to see if there are drug cards with the pharmaceutical companies to help them with their out-of-pocket costs. And then I touched on like health literacy. Like as a pharmacist, we play a very key role in educating patients through counseling, medication, synchronization. And basically what that is so a patient can come into the pharmacy and let's say they're on 5 medications. Instead of picking up one the first week of the month or one the third week of the month, getting it as a one-stop shop that the patient can come in and get all their medications. That helps with adherence. It helps decrease the barrier of going back and forth to the pharmacy. So those are some of the things to ask for. And then medication therapy management. Um, some pharmacies offer this, and a lot of patients, especially with Medicare and even outside of Medicare, basically what the pharmacy will do is like a full comprehensive review of all the medications that the patient is on, sit down with them. Now, I think they're doing it via through telehealth and having conversations around common side effects. What are they taking? Because also in the healthcare system, especially when we have our older patients, we have what we call polypharmacy. What happens is patients get their medications at one pharmacy, and then they get medications at another pharmacy, and then they have multiple doctors that are specialists. And these new providers don't know what the patients are taking. Um, they often tell a patient to bring in their list of medications, but when you have so much that is going on around, and then to have this list and to keep up, like literally, I've seen patients come in with full Ziploc bags of medications, and unless you have studied and trained in knowing all that information, a lay person is not going to be able to speak to their medications. So those are some solutions to those issues. And then thinking about like the access to care, I love that telehealth and like the telepharmacy services are expanding. A lot of pharmacies now offering delivery. Yes, it may come at a cost, but if a patient is unable or their family member is unable to get them to the pharmacy to get their medications, if they have the resources, they could get their medications delivered to them.
And all right, Jennifer, do you have anything to add?
So I guess were you asking like for just more details on ways that our organizations will can help with combating some of these problems? Well, I think the one other item that I didn't bring up before, and they may have something similar at PAP. I know you all a lot of advocacy type of work that you do there, but we do have a program called Access, and it supports people who are fighting disability. They've been denied, and it's only for, when I say only for, they will give free legal advice to anyone that calls. So it's something most places won't do. They're not trying to get anybody enrolled in a class action suit. And so it's kind of nice to know that there is someone out there that can answer questions. They're a very small team. So as far as taking cases go, we have about 5 different diagnoses that we very specifically will cover, but they have taken cases on in other ways. But it's to help people who are, not able to get that disability themselves once they've gone through the first whatever process that they've filed the paperwork. And it also can be to ask questions about what types of things. We just know that this is a really difficult thing for people to have to do. the amount of dignity that people lose when they have to do things like find out about a complex medical problem and then figure out who they're going to have to ask to help them pay for it, and then figure out a way to move through all the paperwork where they're, making an admission that things in their life are changing pretty drastically. So I think on top of all of that, just being incredibly sensitive to whoever is calling in on any moment of any day, because we don't know what other people have going on at that moment.
And to Jennifer's point, so Patient Advocate Foundation, it does take a true army of people to try to help everyone kind of with their needs. So, as nonprofit organizations, as we learn and discover, our patients' needs, we continue to evolve, and a lot of our programs do that. So while our foundation was on case management, our case management actually was the fuel of why we started a lot of other educational assets and advocacy, as well as our financial services and those kind of support needs. But we do address the disability process as well, helping people even understand eligibility and what qualifies you, as well as the application process. And should you be in a denial scenario, what next steps that we need to take with you. The same thing applies for health insurance navigation. So right now we're in Medicare open enrollment. It's a critical time to be evaluating your plan, regardless of how content and happy you are. You want to know if there's going to be changes. You want to make sure that your treatment that you're on now and what you might project to be on is covered benefit, whether that's a network or a particular medication, in those elements, and do a cross comparison against not only what your premium is, but also what your co-insurance, your co-pays, as well as your out-of-pocket maximum, because oftentimes it truly is a math problem to see it can, if you really have some care goals, you might want to look at more expanded access. So the same thing's going to apply as we move into November and we have marketplace open enrollment, or if you're sitting with a commercially insured plan through your employer, pay attention to those timelines. Get ahead of it. Don't wait till the last minute, because these are really thoughtful. You need to be thoughtful about what you're choosing, and even might have to have some conversations with your provider to make sure that you understand what your benefits are, and then to maximize any of those resources. So we've talked a little bit about them, but they're not, if you don't really know it's not something that you might not be aware of. And so if you don't apply, then the benefits aren't there. And that's what we're all here to do, is to try to create that, be that resource for you so that you are benefiting from every possible solution, and also those creative problem solving around it, if it's not a one-for-one.
So that is all that I have as far as questions that came in pre-registration and some of the things that have popped in the chat. I will go ahead and open up the floor to anyone who's in the chat if you want to come off mute and ask any questions for Aaron and James and Jennifer, or you can pop them in the chat if you don't want to speak out loud. That's also perfectly fine, and just sort of give space for anyone to ask any questions. I see a hand raised over here.
Did you see somebody? Good.
Yeah, I do. Let's see, just now, if you want to come off mute, then you can go ahead and ask your question. All right.
Hello.
Hi.
Hello.
Hello.
Hi, we can hear you.
Yes, good night. It is 1 at night here in Tanzania. Actually, I subscribed and I had set a lot of reminders to ensure that I do not miss this webinar. You can imagine how it is at night, 1 in the night, but I'm awake waiting for this. So thank you very much for this, because something I really wished to join. And I really wish that next time I should join. I do not know whether I can get a direct email for someone that I should get in contact to, so that I should be in regular communication. I'm responding this because I am aware challenges is a baby is born with the genetic conditions. They face a lot of.
Oh, it sounds like you cut out for a moment there. Can't hear you anymore. Well, we will share the email addresses and sort of the websites for all of our panel here. So if you want to get in contact with any of them after this webinar, then you'll be able to reach out to them. And I'll also send in a follow-up email with some of the resources, or all of the resources that have been mentioned in this call so far. So if that is something that you all in particular came to this webinar to get, don't worry, you'll be able to get those. And if you want to go back and rewatch this later, it'll be up on our Global Genes YouTube channel at a later time. If there's anybody else who has any additional questions, or want to drop them in the chat or say them out loud, then by all means, now is the time before we begin to wrap up. All right. Well, if nobody has any questions, that's all right. Aaron, James, Jennifer, I'll just give you one last time to just hold the floor to share anything else about your organization, what can be provided, any way you want to help, contact information, anything like that that you'd like to share with everyone before we start to close out.
I think our biggest takeaway from this is that we understand that this is a very common theme, as we shared at the very beginning of this discussion, and the webinar that we actually did prior has a lot more detail around what our organizations offer. I strongly encourage that you review that. It's on demand. But these are common, and they are also things that are very challenging, and we mentioned earlier, literacy, understanding, knowing what kind of resources and how to navigate these things regardless of where you are in disease. So be sure, so just understand that we're here to help and try to be a best resource for you, and trying to kind of align those things to take away some of those burdens and pressures around the financial and time toxicity around all of these when you're prescribed care, that our goal is that you get access to it. So how we do that is very individualized to you as a person and what's available for you, but we're going to do our very best to try to take away some of those hardships for you.
I don't think anybody could have wrapped it up better than that. That was awesome. Just echoing all of the things that Aaron said, just reach out to any and or all of us if needed. As I think, Aaron, you said earlier, it does take a village. And while, as I think some people see all of us as competitors, we're really peers in a big support system. And we all, help support in a bit of a different way, which can be confusing at times, but it also means that there's a lot of different choices out there. So reach out and ask for help and just say, I would love some help navigating this, and see if you can't find some of those resources to help you get all those pieces put together and held together. Thanks for the opportunity today.
Absolutely. And just to add, I ask anyone, especially if it's not a need directly for you, but if you know anyone, and I'm sure Jennifer and Aaron, you can speak to this, that PAN is 20 years old this year, and I go to conferences all throughout the year, and it amazes me about the amount of people, healthcare professionals, patients, organizations who do not know about the work that we do and the things that we offer, and not even just PAN, patient assistance programs in general. So the biggest thing is like educating and spreading the word to other people that there are resources. Here's PAN Foundation. Here is any of the organizations that are listed here, PATH, and let them know that there are some services that are available. That's the biggest way, is word of mouth, is just getting it out there and just educating doctors educating pharmacists, just letting them know, and patients, that there are resources available to help patients with their out-of-pocket costs.
Before we wrap up, actually, I do see another question popped up in the chat. If we want to maybe go over that in the last 2 minutes that we have here. What if your medication is not any formulary and it costs over $100,000? Your insurance is not going to pay for it, if you sort of speak onto that or similar situations.
So I have some immediate gut follow-up questions that would be very, very beneficial to understand. When we say it's not going to cover it, I'm going to assume that there's been an appeal process with a formulary exception, and that's not been resolvable. And, just would be helpful to understand where that's stemming from to kind of drive the conversation. If you have a very narrow, limited insurance plan, maybe open enrollment time is a very critical time to find a plan that does actually have the medication you need in the formulary, so that becomes a solvable solution. But also speaking to the manufacturer of that medication, because oftentimes they have programs that will provide assistance when you actually have proven that you have appealed it and it has been denied and you have no access, but it's prescribed treatment. They'll screen you for their patient assistance programs.
Either of you have any additional comments, anything to add, Jennifer and James?
No, that's exactly where I was going to go, because when I read it, it said that it wasn't for the formulary insurance. So to your point, Aaron, it may be that, and this may be a lot easier said than done, is with this open enrollment, finding a plan that medication is covered, and to seeing if the pharmaceutical company has some assistance for that particular medication.
And earlier we talked about some of the different things. Aaron, you gave some great examples of ways to be creative. Unfortunately, you have to do that when trying to figure out some of these really high costs. But another avenue that maybe many people already know about and have been in touch with, but I don't think we brought it up, is just advocacy orgs in general, if you fit into one. I know sometimes the problem is that you have this incredibly rare disease and maybe you're taking a treatment that's off label. And so it does fall, unfortunately, into a place where lots of coverage doesn't touch. However, in a lot of other circumstances, there are at least advocacy groups out there, even in the undiagnosed, I have found, that are based on symptoms of disorders that have not yet been diagnosed. And so maybe just reaching out to your community of peers or trying to find that community and plug in, because they've often stumbled over the same barriers that people behind them are going to also stumble over, and they might have some, shortcuts for you.
All right, well, thank you so much for that. We'll go ahead and leave it there. Like I said, expect a follow-up email from James and resources. I'll also include websites and contact information for Aaron, James, and Jennifer if you'd like to follow up with them at a later date and maybe see what potential assistance resources are available to you. And with that, I will let everyone go.
Thank you so much for this.
Thank you.
Bye.
Good day. Bye.
Thanks, everyone.
Thank you.